Okay, we are back again with another episode of Clinical Conversations, and today we have Stephanie May, occupational therapist and clinic manager at CORA Physical Therapy, and we have Ashley Langford, our director of clinical excellence at the CORA Institute for Clinical Excellence and of CORA Physical Therapy, of course. And I am Adam Goodrich with the marketing team at CORA, and today we are going to ask Stephanie questions about being a certified hand specialist, and from the patient perspective, what does that mean to a patient, when to pursue services, and as far as from the clinical perspective, should I become a certified hand specialist? Can I do it as a PT? Do I need to be an OT? And questions like that. And Ashley, would you add anything to our list of curiosities for Stephanie?
No, I am just excited to be here. Stephanie is a phenomenal person and professional. And you can always tell that when you hang out with someone in their clinics and they've got several mentors that have worked under them and are just accelerating their growth because of that person. So excited for this.
Well, thank you so much for that introduction, Ash.
And okay, so let's go, Stephanie. Tell us a little bit about what a certified hand specialist is. Give us the high-level overview of that. Let's start there.
Yeah, so I'm going to start on the clinical end of it. A certified hand specialist, hand therapist, is an extra certification that you would get after you take your boards. Both an occupational therapist or a physical therapist can get that extra certification. It is a small number of specialists that are in the country. There's only less than 20,000 of them in the whole entire nation. To go off the name a little bit, it's a little misleading, and we don't like it because it's called a certified hand therapist, but really we're a total upper extremity specialist. So we can go all the way from the fingertips all the way up to the neck level in terms of treating, in terms of our specialty and what we really dive into. So in terms of what you need to do in order to get your certified hand therapist certification, you have to be practicing for at least 3 years. So whether you're an occupational therapist or a physical therapist, after you graduate, you sit and you take boards, you have to be practicing for at least 3 years. You have to practice within an upper extremity setting or with patients who have upper extremity concerns for more than 5,000 hours. And then you have to sit and you take a whole nother boards that you want to just pull your hair out, but you sit and you take a whole nother boards, and then once you pass it, you become a certified hand therapist.
So does that make you just better than treating upper extremity pain than other people?
To an extent, I would say, because you show your passion. You show the world, this is what I am a specialist in. This is what I truly, truly specialize in, because this is what I love and this is what I love to do. However, it does not always make you better than someone who doesn't have a certified hand therapy certification. There are plenty of occupational therapists and physical therapists who have been working for years in an outpatient setting, and they are just as great. However, I really enjoy this certification because it shows your passion for learning and your passion to continue to specialize and treat people to its fullest potential.
Okay, and if I am a patient and I have, what would a good example be? A golfer's elbow? Does it matter? We're talking about hands, so maybe stick to the hand, but I can talk about anything, right? Because you just said it really runs the gauntlet from hand to up the neck.
Yep, up to the neck level.
A venture away from the hand.
Okay, yeah. So I have golfer's elbow or tennis elbow.
Adam is a golfer too, by the way, so he might be trying to get advice here.
Well, I did shoot a 93 yesterday, so I know everybody.
All right.
No big deal. Okay, so would it be smart of me to explore the PTs in my area and say, okay, well, I see that they have a certified hand therapist. I said specialist in the beginning, but it's CHT. Is that right?
Mm-hmm. Yeah.
Okay, sorry about that. Okay, so is it smart of me to explore looking for a CHT?
I would. The reason being is somebody who has that CHT, they're going to specialize a little bit more. So they're going to know kind of the ins and outs and the little, like the little tidbits, the little tricks that will take you above and beyond. I think anyone working in an outpatient setting has the knowledge and has the passion to treat people, but that CHT is going to take it that little step further to get you a little bit better, make sure your handicap is not as bad, and just really, really dive in to get you as quick as possible back to your golfing game.
Okay, and we talked about this in previous episodes. We talked about how a therapist comes out of school with a great foundation. But you can't really get too deep onto any one topic in 3 years of school or so. So it would be a good idea if somebody does have that passion for treating upper extremity, then this is kind of maybe a good continuing education path for them.
Absolutely. Definitely a great career path. I think being an occupational therapist, there's so many different areas that we can go into, whether it's outpatient orthopedics, we can do neuro rehab, we can even do behavioral health in the jails. So for me, I really love anatomy. My nerd comes out and I love anatomy. So I really wanted to pursue this career and pursue this path of the CHT because it just furthers my knowledge.
I'll just kind of speak to coming out of school. I was lucky enough to work at a private practice. It was a wife and husband. The wife was a CHT and employed CHT. So early on, I got an appreciation for the level of knowledge and appreciation for how they look at a patient, right? So you spoke to that a little bit, Stephanie. That would have been my immediate outside thought process on a CHT is you don't meet a CHT that isn't committed to their profession, period. And they're always going to give that extra point of view. They just come with a more fulfilled background regarding treatment. So they are few and far, but it's a good certification to have for sure.
Okay, then next question. If I achieve my CHT, if I have that certification now in my toolkit, is that the end? Is it CHT 1, 2, 3, or is it, okay, well, I have that. Now maybe my next best step would be the other thing that maybe you guys can help me understand.
Yeah. I mean, unfortunately, once you get your CHT, you are now classified in that top tier level of therapists of less than 20,000 in the whole entire nation. You do have to continue your continuing education and you do have to renew it every year. So it's not just, hey, I got in and I have it for lifetime. There's still an expectation that you continue to learn and you continue to keep up your certification and your knowledge based off of all the new technology, all the new studies and research that keep continuing to come out. However, in terms of a certification, that's your top notch, maybe right there.
Typically, by the time you get there, and I've, speaking to people about how intense that exam is too, the time that you got to put into it.
Yeah.
You're probably ready to just kind of take a little bit of a rest from all that while you actually use the skills that you've learned. So
yeah, definitely.
How long does it take to get the certification?
So if we're talking about like in terms of when you start studying to when you actually take the test, I would say like a good 2 years of studying. So if you're lucky enough to know early on in your career, like, hey, this is what I want to do, this is the path I want to go into, because you just graduated and you have like that student mindset and you have that learning mindset, I always tell people, if you're going to do it and you have an inkling to do it, just continue and start studying now. Unfortunately, with the CHT, there's not too many mentorships that lead you. So it's a very self-guided track. You have to go looking for it. You're not sitting in school. They don't give you a syllabus. You have to have that motivation. You have to have that passion, which I think also makes it so special because people have to strive for it so hard, so if you're going to do it, keep your mindset. It is hard coming from someone who did it after 10 years of graduating. It is hard to get back into that mindset again of like, okay, I got to open a textbook. Here we go. Make my own syllabus for myself. But
Adam,
total 2 years.
Okay.
And I remember too, like early on, kind of thinking to myself, certified hand therapist. What do you need to be certified in the hand? And then, because as a physical therapist, I'm like, well, we don't have certified foot therapist. But here's the deal. Like, Stephanie, you can elaborate from this, but there really isn't another part of your body that you use near as much as your hands, which you think to yourself, duh, but the more you think about it and the complexity to the hand and the wrist and the forearm, I mean, the amount of things we have in here, the different pulleys and anatomy and that's just in there, and then you add some type of trauma to it. CHTs, I mean, the amount they have to study on post-op protocols, delicate ways to handle different components to like wounds and rehab. It's phenomenal. So it really is a cool.
Is there a one place to go to find one? Can you go to the
like
CHT
a website?
Yeah,
Yes.
And then there's a library of. Okay.
Yes. So you can go to what would be like the certification website. So the Hand Therapist Certification Board. So it is htcc.org, and it will list all of the certified hand therapists. So when you take your boards and when you sit for your boards and they say, hey, congratulations, you passed the test, they will create, I'm running out of words. It's not the yellow pages. What's the yellow pages in internet form?
Listing,
a library,
right?
Yeah. They create that for you. So then that way, if you are looking for a patient, or I'm sorry, if you are looking for a therapist from a client perspective, you can say like, okay, my doctor recommended a CHT. Well, I can't find one and nobody says that they have one. You can just go right on the website and it'll tell you where they're all listed.
Cool. Yeah, database of some kind.
There you go. Database.
Okay, and there was another question. Ashley, do some filler while I think of the question that I just forgot.
If you're interested too, is ASHT also another organization that's good to kind of review or study?
Yep.
Is that right? It's coming to mind.
Yep, that's the national board. So that's
the American Society of Hand Therapy.
Yep. So that kind of gives us, as therapists, like more of the resources, how to study, continuing education, that sort of things as well. Mm-hmm.
Okay, so and I think what I was going to say is it's worth noting that we are not affiliated with these organizations at all. In fact, I feel like we're giving them a pretty good plug right now. At no cost, which is great for them. And it's been a fun conversation. The next thing, though, is that you teach a course, though, or courses.
Yeah.
And would that be, or might those be courses that you would take after the CHT? Would those be courses that you would take before the CHT? Is there any kind of connected material?
Yeah, absolutely. So through our CORA Clinical Institute, it's open to both our employees and somebody who may not even work for CORA. It's a really good way to start that learning process or to start your brain processing of how to study for the CHT and like how to prepare for the CHT. The course, it's a nice certification and it's a group of courses, so it's not just one thing. It goes through the whole entire upper extremities, which is really cool. The course that I specifically teach is splinting. So splinting 1 and 2, but now it's also called orthosis because the literature is changing. But orthosis courses, and I personally think that they are beneficial to take prior to your CHT test and after. Orthosis fabrication, you can never get too much hands-on practice. You can only learn so much from a textbook, but until you actually make a splint and custom form it to somebody to help them protect their post-op thumb or a football player who dislocated his finger and still needs to catch a football. Until you actually make something hands-on with somebody, you don't really get a feel for it. So whether you pass the test or not, you need that hands-on grittiness.
No pun. No pun.
Yeah, no pun intended.
And our certification that we're referencing is mastering the upper extremity. So starts in the shoulder, works its way down to the mid upper extremity to the wrist and hand, and then it goes to splinting, as well as a virtual course on the peripheral nervous system. I mean, there's just so much when it comes to nerves that I've been, lucky to be involved with this group designing the courses. But yeah, splinting is a pretty unique, cool thing to watch. I mean, some of the stuff that they get into with custom splinting, I mean, they put little pulley systems on to support parts of the hand. So that's why they've got to think outside the box. Is they got to know what the injury is, what the risk is, and how they can support it.
Yeah.
But they're changing the name from splinting to
orthosis.
I like how PTs and OTs, like, instead of something simple, like a name would be simple, they like to complicate it and have something more difficult to say and remember. But that's, of course, another topic. Sorry, you were going to say something.
For discussion. Take the splinting course and you'll find out.
Okay, well, any final thoughts? I think we really got into it on the certified hand therapist, which is great. One quick question: the course that you guys are just talking about, would that be like, that would be like a good dynamic warm up before taking the CHT? Okay, all right.
Yeah, absolutely. It's a good preparatory track to take, and then there's certainly a lot out there too beyond that to prepare for the exam. So.
Yeah.
And I think we posted some pictures from the splinting part of a course recently, so I'll plug our Instagram at CORA PT as well, in case you want to go check that out. You might have to scroll down a little bit. Okay, any final thoughts?
I would say with those courses that we were talking about, like I said, there's really not, you have to be like that self-motivated. There's not really that large community. What we're trying to do is we're trying to create that community so that you have other people that are also interested and also have the same mindset, so you can throw ideas off of and you have somebody to have your back, because it's scary.
A quick anecdote: my wife was taking and pursuing her CFP, and which is also very hard to do, but the mentor community is vast, and she was able to connect with different people and then become a mentor herself. And it was good for her, very comforting for her to have somebody to talk to about the challenges of studying and, like you said, being self-motivated. Yeah,
it's really special.
And to like Stephanie said, for so few out there, that's probably why Stephanie is now mandated to be a mentor for so many. No, I'm just kidding. She chooses to do it.
Choose it.
I would wrap up by saying of all the different certifications out there for clinicians, this is one of the highly sought after. There is a need in the community, particularly surgeons they're always looking for. That's one they'll request. So if you're looking for something that's going to make you marketable and valuable too, and for the need, it's one to pursue.
Okay. All right. We will wrap up there. Remember to rate, review, and subscribe. And thank you, Stephanie, and thank you, Ashley. And we're going to wrap this one up. So thanks.
Thank you.
Thank you.